the Secretary of the Government of the Federation, honorable ministers here present, directors, Director General, ladies and gentlemen. As at the end of yesterday, Nigeria has ramped up testing by 1,127 to a total of 27,078 tests performed, which yielded 4,399 cases in 35 states, with a gender ratio of 70 to 30% for men and women. 778 persons have been discharged home happily, and we have sadly recorded 143 fatalities, a case fatality ratio of 3%. The breakdown is as follows: Lagos 81, Jigawa 35, Borno 26, Kano 26, Bauchi 20, FCT 13, Edo 12, Sokoto 10, Zamfara 7, Kwara 7, Kebbi 4, Gombe 2, Taraba 2, Ekiti 2, Ogun 2, Osun and Bayelsa 1 each. Kogi and Cross River states have not reported any cases, but we are working with the state authorities to be able to visit and validate the situation. A team from the Federal Ministry of Health, made up of experts in various specialties, including the NCDC, is on standby to proceed to Calabar, as we have discussed with His Excellency Governor Ayade, as soon as possible when arrangements have been concluded. They will take with them resources needed to support the state. Senior management of the Federal Ministry of Health and clinical case managers in our hospitals this morning participated in a multinational teleconference with Chinese medical and academic experts in Beijing, where much insight was gained into the treatment strategy of China, and also other matters of common interest were discussed. The learnings from this intervention are valuable in re-examining our methods. It is important that our response to COVID-19 be a concerted national collaborative drive to stand a better chance of being effective. This requisite synergy cuts across the tiers of government, levels of care, and builds on partnerships to get it right for our country. It must be sustained and extended with room for interstate collaboration. So far, our efforts are yielding results, as shown in states where panic and fright were initially rife, but are now subsumed. I salute all our healthcare workers at the front line, who are our human resources, trainers, hands-on practitioners alike, who make care possible and are the most important element of our response. Your contributions are recognized, and we take up our hearts to your service. The ministerial task team deployed to Kano State to assist in the containment effort and help to support the state government providing direction in managing COVID-19 situation has made significant gains. Together with the line directors from the Federal Ministry of Health and the IROA team, they have achieved several milestones, including enhancing community confidence continuous training and capacity building to increase the pool of trained healthcare workers, doctors, nurses, hygienists, food handlers, etc. More than 100 ambulance drivers and patient handlers have been trained who have since been rendering service. The surveillance and epidemiology pillar organized a training session for state workers who have commenced field work. And the investigation into unexplained deaths in the state is yet to be completed and submit a report. The task team, led by one of our permanent secretaries, and 3 experts, including infectious disease specialists, visited Katsina State for situation analysis and were able to offer support. A detailed report is awaited from Dr. Guazo and is expected to provide a roadmap to addressing the challenges in line with our response pillars. Contingent of the Federal Ministry of Health team in Kano will also visit Bauchi State on a fact-finding mission and engage the government to map out their needs. A team will also visit Sokoto at the invitation of state authorities on a similar mission. With our entry into community transmission phase, there is an increased role for the National Primary Healthcare Development Agency, who shall now play a stronger role in the health sector response architecture. This will include activities from case finding to case management of asymptomatic or mildly symptomatic cases. The Disease Dome Treatment Center, as the SGF has said, is a project of the Coalition Against COVID-19 and is complete, ready for commissioning. The Honorable Minister of FCT will participate in the event. The center is fully self-contained. It comes with its own PCR laboratory and a fully equipped ICU unit and an incinerator to destroy medical waste. Over 250-bed facility adds a tremendous boost to the capacity in the Federal Medical Center. Federal government continues to work with World Health Organization on the treatment trial called Solidarity, with the following states participating: Lagos, FCT, Ogun, Kaduna, Sokoto, and Kano. As restrictions are eased, I urge citizens to adhere to public health advisories on infection prevention and control. These include mandatory use of cloth masks outside of your homes and physical distancing. With regard to the use and maintenance of masks, it is important to emphasize that the mask must cover your mouth and your nose. During face-to-face conversation, your mask should cover your mouth and nose and should not be under your chin, lest the purpose is defeated. Cloth masks must be washed with soap and water daily and sun-dried. The usual advisory that I give on personal hygiene and respiratory hygiene is hereby repeated, especially with regard to those who have a cough, sneezing, and to use hand sanitizers. Thank you for your attention.